Hi, my name is Keri Claybourn, and I am with Progressive Health. I am at the Women's Hospital at High Point Therapy, and I am going to do a little three-part series here on cancer rehab. Um, just a little bit about me. I have been a physical therapist for about 15 years, and I am a cancer survivor myself. So that is kind of what me got me invested in working on improving the quality of life for cancer patients because I just feel like you're going through all of these different surgeries, different treatments, and maybe people are explaining things, maybe they're not. Maybe we just don't hear it because there's so much information that we're being told. But really, once we are here and on the other side of things, we need to know how to improve our quality of life and not be dealing with all of these side effects because of the treatments and surgeries that we've had. So, this first series today is going to be on neuropathy and gait and balance, and then feel free to tune in the next couple of weeks. The next one will be on weakness and fatigue, energy conservation, and then the third one will be on lymphedema and kind of post-surgical care. So I am a lymphedema certified therapist as well. And there's just a lot of things that we can help you with as a cancer patient. So, um, as I mentioned, the role of therapy in the cancer journey, patients can experience a variety of signs and symptoms that can range from complaints of weakness, fatigue, swelling, numbness in your hands and feet, decrease in your balance, falls, and pain. And the big thing is we can help. A lot of times patients are like, why in the world am I coming to therapy? They have no idea how we can assist them because they think of a traditional physical therapy role. And once they get to see us for that first evaluation, they're like, oh my gosh, I had no idea that you guys could do things for this or that this even existed. So that's kind of my goal as well as our team's goal at High Point. So um, today, we're going to first start talking about kind of our walking, which is our gait. We can work on improving your endurance, increasing your distance, your speed, and your balance to help reduce your fall risk. When you have gone through treatments for cancer, fatigue is one of the common things. And in doing that, you're not walking, you're not moving as much, your endurance is down. And a lot of times you're just wanting to get back to a normal, if that even exists. So patients are usually at a higher risk of falling post chemo due to this weakness, as well as it's not uncommon to develop chemotherapy-induced neuropathy, and that can increase your unsteadiness and decrease your reflexes in your feet, reduce your ability to kind of know your balance and your position in space. And during this time, we may be able to just kind of temporarily help you get an assistive device or fit with braces. Sometimes patients need an AFO temporarily for their foot to help with foot drop because the reflexes are absent due to the chemotherapy. Um, so, because of all of these variables, we're also looking at your balance is not as good. And speaking of that chemotherapy induced neuropathy, this is where you're going to have damage to the peripheral nervous system because of the toxicity of the chemo agent. And these are some three different classes of chemos that are listed that are more prone to developing the chemotherapy induced neuropathy. Patients with this will describe a numbness and tingling in their hands or feet. And their feet, especially, they'll say it's like painful, like I'm walking on hot coals or rocks. And there's no magic wand to make this go away. But the big thing is to keep moving because if you stop moving, then you lose range of motion, you lose that strength, which will then affect your balance and your ability to know your position in space. And so, in doing that, we do work on some balance stuff. And here's some examples of some exercises that we'll have patients do at home, as well as in the clinic, where they are putting their feet together in what we call a narrow base of support. They have their eyes open, and then we repeat eyes closed. And then we'll also do it on foam, which is an unlevel surface. And no, patients aren't going around walking on foam often, but we do this so that our body will be able to adjust to unlevel surfaces, like if we're walking outside in the grass or on a sidewalk or anything like that. The thing with this neuropathy too, and discussing, we were saying you may not have that sensation or feeling in your hands or feet is safety. And you want to make sure that you're using gloves when you're doing yard work, or if you are cooking and you like to cook, be aware that you may not be as noticeable with the temperature changes. So you need to make sure that you know you're at risk for burns. So you want to use well padded pot holders when cooking. Look for regular cuts and scrapes on your hands and feet. Make sure if it's cold or really hot outside that you're dressing appropriately, because your body may not be able to tell you those temperature changes as well. The other thing is you want to make sure that you're cautious when you're driving. If you can't feel properly with your feet, you may hit the brake pedal instead of the gas pedal. I had a patient that do this, and unfortunately had a wreck, but everyone was okay. So these are real concerns that are happening. You want to make sure things are clear so you can avoid tripping. Using that assistive device, even if it is temporarily, we rely on vision a lot for our balance. And so if you are getting up at the nighttime, go into the bathroom, walk into the kitchen to get a nighttime snack, make sure you turn a light on or you have night lights so that you can rely on that vision to help give you proper feedback, since your feet and hands may not be able to. So, as I mentioned earlier, what are some ideas for treatment for this chemotherapy induced neuropathy? There's no magic wand, but compression can be helpful for this. As listed here is a picture of some CEP socks. I've had some patients do really well with these, as well as trying infrared socks that they've ordered off of Amazon. Some mild compression gloves for the hand can be helpful too. We usually incorporate a lot of exercises to work on the intrinsic muscles of the hands and feet. Because it is painful and stiff, patients don't want to move. And then as a result of that, you become more and more weak, which affects your walking, balance, and puts you at more risk for falls. So we incorporate lots of exercises for the hands and feet for getting them moving, strengthening, using putty. Um, I a lot of times will have patients, if they have a hobby that they like to do that involves like fine motor, like crocheting or needlepoint or buttoning things or picking up beads out of stuff, that can be helpful too. And discussing, safety with walking, we discussed making sure that you have an assistive device during that time. And you can also talk to a doctor about possible benefits from supplements. Um, you always want to make sure if you're actively going through treatments that you're not going to take a supplement or something that is going to counteract with your chemotherapy. But vitamin E, calcium, magnesium, those can be helpful. Sometimes the physician may prescribe a gabapentin or Neurontin or a Cymbalta, and that can be helpful in reducing those effects of the neuropathy. There's a little bit of research out there about topical treatments using cocoa butter, menthol-based creams twice a day. I think the big thing with that is just that you're getting in there and massaging, which is making it a little bit more comfortable so it's not as painful for you to touch those areas. And that gentle massage just feels good. So as I mentioned, there's no magic wand to make this chemotherapy neuropathy go away. It does usually get better with time, but in the meantime, we need to look at management to improve your quality of life and safety to help reduce any fall risk, as working on that balance and your walking and all that kind of comes hand in hand. So this will be the first part of our series. So tune in for the next one. The next one will be on fatigue as well as weakness.